Do you wake up every morning feeling as though a thick layer of mucus is glued to the back of your throat? You swallow, you cough, you clear your throat again and again. It may improve for a few minutes, but then that uncomfortable sensation returns. Most people over 60 assume this is simply part of getting older, a lingering cold, or just bad sinuses. But persistent throat mucus is often not coming from an infection at all. And the surprising part is this: the substance you are trying so hard to clear may not be the main problem. In many cases, your throat is reacting to irritation. That irritation may be draining down from your nose. It may be rising silently from your stomach. It may be worsened by dry air, dehydration, allergies, or even a medication you take every single day. And sometimes, more than one cause is working at the same time. Here is where the cycle becomes frustrating. The more forcefully you clear your throat, the more irritated those delicate tissues can become. Then your throat feels coated again, so you clear it once more. What began as a symptom can slowly turn into a habit that keeps the discomfort alive. But please do not assume every case is harmless. Mucus accompanied by trouble swallowing, unexplained weight loss, coughing up blood, chest pain, shortness of breath, a persistent hoarse voice, or symptoms that continue for weeks, deserves medical attention. In this video, I will show you why this problem becomes more common after 60, how to tell whether the likely source is your nose, your stomach, your lungs, or the throat itself, and which simple changes may help. Stay with me. Because one of the most overlooked causes often produces no heartburn at all. Many people treat their sinuses for months, and while the real source is quietly irritating the throat from below. And later you will learn when home care is no longer enough. So, why does this problem seem to appear more often after 60, even in people who rarely had throat trouble before? The answer is not that your body suddenly starts producing endless mucus. More often, several small age-related changes make normal secretions harder to move, easier to feel, and more likely to collect. Inside your nose, throat, and airways are microscopic hair-like structures called cilia. Think of them as a slow-moving cleaning belt. They help carry mucus, dust, and tiny particles away from sensitive tissues. As we age, this clearance system can become less efficient. The mucus may sit longer, thicken more easily, and become more noticeable when you swallow or speak. At the same time, many adults drink less water than they realize. The sense of thirst can become less reliable with age. And some people intentionally limit fluids because they worry about frequent bathroom trips. But when the body is even mildly dehydrated, secretions become stickier. Instead of sliding away unnoticed, they cling to the back of the throat. Then there is the medication factor. Certain medicines can dry the mouth and nasal passages. Others may worsen reflux or change how secretions feel. This does not mean you should stop any prescription. It means persistent mucus should be discussed with a clinician who can review your full medication list, including over-the-counter allergy tablets, cold medicines, and sleep aids. But here is the important distinction. Feeling mucus does not always mean your body is making too much of it. Sometimes the lining of the throat has become unusually sensitive. A small amount of normal drainage can feel like a large lump. You clear your throat. The tissues rub together. The irritation increases. And soon, every swallow draws your attention back to the same spot. And there is one more clue. If the sensation is worse after meals, when lying down, or first thing in the morning, the source may not be your sinuses at all. It may be coming from below. Let me introduce you to Margaret, a 68-year-old retired school secretary who thought she had developed a permanent sinus problem. Every morning, before she even finished her first cup of coffee, she cleared her throat repeatedly. She kept tissues beside her chair. She carried cough drops in her purse, and she blamed the changing weather. Some days she felt mucus sliding down from behind her nose. On other days, there was no obvious drainage at all, just a stubborn sensation that something was sitting in her throat. She tried drinking less milk. She bought an over-the-counter allergy medicine. She even started sleeping with the fan pointed away from her face. Nothing changed for long. Then her daughter noticed a pattern Margaret had missed. The throat clearing became worse after dinner. It increased when she bent over to load the dishwasher, and on mornings after a late-night snack, her voice sounded rough, tired, and strained. Margaret never felt burning in her chest, so reflux seemed impossible. But throat reflux does not always feel like ordinary heartburn. Stomach contents can travel high enough to irritate the voice box and throat, producing hoarseness, coughing, frequent throat clearing, or the feeling of excess mucus. And these symptoms may be stronger after eating, bending over, or lying down. That does not mean every person with throat mucus has reflux. Postnasal drainage, allergies, medications, infections, airway disease, dryness, and swallowing problems can create similar symptoms. That overlap is exactly why guessing from one symptom can waste months. Quick favor before we go further. Tell me your city, state, or country in the comments. Seeing where you are watching from helps me understand the climates and everyday conditions affecting viewers, so future advice can be more useful. Now stay with me, because the next clue is the one many people overlook. Margaret's real breakthrough did not come from finding a stronger cough drop. It came from observing the timing. When is the mucus worst? Is it after meals, during the night, first thing in the morning? Does it arrive with sneezing, itchy eyes, or nasal congestion? Does your voice become hoarse? Do you cough when you lie flat? Those details can point toward the source. And in Margaret's case, the strongest clue was not what she felt in her stomach. It was what happened in her throat after dinner. For many adults over 60, the most surprising cause of constant throat mucus is not a cold, and not always a sinus problem. It is laryngopharyngeal reflux, often called silent reflux. This happens when small amounts of stomach contents travel upward, beyond the esophagus, and reach the throat or voice box. The throat is far less protected than the stomach. Even limited exposure can irritate its lining, creating swelling, coughing, hoarseness, a lump sensation, repeated swallowing, or the feeling that thick mucus is always present. And many people with this pattern do not experience the burning chest pain they associate with ordinary acid reflux. That is why the source can remain hidden. Think back to Margaret. Her symptoms became stronger after dinner, when bending over, and on mornings after eating late. Those timing clues matter. Lying flat removes gravity's help. A full stomach makes backward flow more likely, and eating close to bedtime gives the stomach less time to empty before you lie down. Coffee, alcohol, chocolate, peppermint, fatty meals, spicy foods, and large late dinners may worsen symptoms in some people. But triggers vary. The goal is not to fear every food. It is to notice what repeatedly happens in your own routine. Here is what most people do not realize. The mucus feeling may partly be inflamed, sensitive tissue, rather than a large amount of phlegm. Once irritated, the throat becomes easier to trigger. A tiny amount of normal drainage can feel enormous. You clear your throat for relief. The vocal folds strike together, and the irritation continues. But silent reflux should not be diagnosed from symptoms alone. Throat clearing, cough, hoarseness, and a lump sensation can also come from allergies, postnasal drip, asthma, medication effects, swallowing problems, voice strain, or other throat conditions. So what should you watch for? Notice whether symptoms increase after meals, when reclining, during the night, or after waking. Pay attention to morning hoarseness, a sour taste, frequent belching, or coughing after eating. Write these patterns down for 1 week instead of relying on memory. Do not automatically begin long-term acid medication, and do not stop prescribed medicine on your own. Persistent symptoms deserve a clinician's assessment, especially if swallowing is painful, food feels stuck, your voice remains hoarse, or you are losing weight. A simple symptom diary can help your doctor distinguish a repeatable pattern from a sensation that appears randomly throughout the day. But reflux is only one half of the story. The next common cause comes from above, and several everyday habits can quietly make that drainage thicker. Your nose and sinuses make mucus every day. even when you are completely healthy. Its job is to trap dust, pollen, germs, and other particles before they travel deeper into the lungs. Normally, you swallow this thin drainage without noticing it. Postnasal drip begins when that drainage becomes excessive, unusually thick, or simply more noticeable as it moves down the back of the throat. This can happen with seasonal allergies, a cold, chronic sinus inflammation, changes in temperature, smoke, strong fragrances, or non-allergic rhinitis. In older adults, mucus may become thicker, while the nose's natural cleaning system becomes less efficient. That combination can lead to more drainage, more coughing, and the constant need to clear the throat. Here is a useful clue. If your throat mucus comes with sneezing, itchy or watery eyes, a blocked nose, or symptoms that become worse around pollen, pets, dust, or outdoor yard work, allergies become more likely. If the drainage is thick and discolored, with facial pressure, reduced smell, or congestion lasting many weeks, chronic sinus inflammation may need to be considered. But color alone does not prove that you need an antibiotic. That is important. Many people see yellow or green mucus and immediately assume they need antibiotics. But mucus color can change because of inflammation, immune cells, or dehydration. The color by itself does not reveal the cause. Now here is another surprising point. Dryness can create the opposite problem and still make you feel full of mucus. Heated rooms in winter, air conditioning, mouth breathing, and low fluid intake can dry the lining of the nose and throat. The secretions then become thicker, stickier, and harder to move. A person may say, "How can my throat feel wet and clogged when my mouth feels dry?" Both can happen at the same time. Sticky mucus clings, instead of flowing normally. Dry indoor air can also irritate the throat. And while a humidifier may help some people, it must be cleaned carefully. A dirty humidifier can spread mold, bacteria, and other irritants into the room. Then consider your medicine cabinet. Hundreds of medications can reduce saliva. Common examples include some medicines used for allergies, colds, depression, high blood pressure, bladder control problems, and sleep. Less saliva may make swallowing less comfortable and leave normal secretions feeling unusually thick. Never stop a prescribed medicine because of a video. Instead, ask a pharmacist or clinician whether dryness could be a side effect and whether a safer adjustment may be appropriate. One more caution. Older antihistamines may dry secretions. They can also sometimes cause drowsiness, confusion, constipation, blurred vision, or urinary difficulty in older adults. Over-the-counter does not automatically mean ideal for everyone over 60. The strongest clue is the company your mucus keeps. Nasal symptoms suggest a source from above. Meal-related hoarseness suggests irritation from below. Chest congestion, wheezing, fever, or shortness of breath point toward a different conversation involving the lungs. But regardless of where the irritation begins, one common response can quietly keep it going. That response is repeated, forceful throat clearing. Now for the belief-breaking part. Clearing your throat may feel helpful, but doing it forcefully dozens of times a day can keep the irritation alive. Your vocal folds are two delicate bands of tissue inside the voice box. During a hard throat clear, they strike together with force. When this happens repeatedly, those tissues can become more inflamed and sensitive. That irritation creates another tickle, another coated feeling, another urge to clear. And it becomes a loop. Sensation, throat clearing, brief relief, more irritation, then another sensation. The relief is real, but temporary. And because the relief lasts only a moment, your brain learns to repeat the behavior. Soon, throat clearing becomes almost automatic. You may do it while reading, while watching television, while speaking on the phone, or every time you begin a sentence. Small sips of water, or a gentle swallow, are often less irritating alternatives. This does not mean you should suppress every cough. Coughing protects your airway when food, liquid, or secretions go down the wrong way. The goal is to replace unnecessary, habitual clearing, not to interfere with a vital safety reflex. When the urge appears, take a small sip of water and swallow. If water is unavailable, swallow once or twice without forcing your throat. You can also breathe slowly through your nose, then exhale gently through lightly pursed lips. Another technique is a soft, breathy huff, as though you are gently fogging a mirror. It moves air without slamming the vocal folds together as forcefully. But here is the crucial point. These techniques manage the cycle. They do not automatically remove the original cause. If reflux, allergies, sinus inflammation, medication-related dryness, voice strain, or a swallowing problem is triggering the sensation, that source still requires attention. And swallowing problems deserve special care. If you frequently choke during meals, cough after drinking, develop a wet or gurgling voice after swallowing, feel food sticking, or repeatedly develop chest infections, arrange a medical assessment. Those symptoms may indicate difficulty swallowing rather than simple mucus. Breaking the throat-clearing cycle gives irritated tissue a chance to settle. But first, you need to know which symptoms are only frustrating, and which ones should never be watched at home. A useful piece of research changes the way we should think about persistent throat symptoms. In a large randomized clinical trial, adults with ongoing throat complaints were given either an acid-suppressing medicine or a placebo. After several months, the acid medicine did not provide a meaningful advantage over placebo for these general throat symptoms. Why does that matter? Because throat mucus, hoarseness, coughing, and repeated clearing are often labeled reflux, based only on symptoms. Yet those symptoms are not specific to reflux. They may also be driven by nasal drainage, dryness, voice strain, medication effects, airway disease, swallowing difficulty, or an oversensitive throat. The lesson is not that reflux is imaginary, and it is not that acid-reducing medicines never help. The lesson is this: persistent throat symptoms deserve a thoughtful diagnosis instead of automatic treatment. That distinction can spare you months of taking the wrong remedy, while the real trigger continues quietly in the background. This is especially important after 60, because mucus can occasionally be a signal from somewhere other than the nose or stomach. Call a clinician promptly if the problem lasts several weeks, keeps worsening, or comes with persistent hoarseness, pain when swallowing, food sticking, repeated choking, unexplained weight loss, fever, a neck lump, or one-sided ear pain that does not go away. Seek urgent help for significant breathing difficulty, chest pain, blue lips, coughing up more than a small streak of blood, or suddenly being unable to swallow your saliva. Also notice whether the material is truly sitting in your throat, or whether you are coughing it up from your chest. Wheezing, breathlessness, fever, or a deep, productive cough may point toward a lung or airway problem. That should not be treated as simple post-nasal drip. And here is the reassuring part. Most persistent mucus sensations do not automatically mean something dangerous. But common and safe to ignore forever are not the same thing. The smartest next step is not always stronger medicine. It is matching the solution to the source. So now, let us turn all of this into a simple plan you can begin today. First, become a detective for 7 days. Write down when the mucus feels worst. After waking, after meals, outdoors, in a heated or air-conditioned room, when lying down. Also, record sneezing, heartburn, hoarseness, coughing, watery eyes, nasal blockage, and any new medicine. Timing often reveals more than the mucus itself. Second, keep secretions easier to move. Drink fluids regularly, unless your clinician has placed you on a fluid restriction for heart, kidney, or liver disease. Water will not cure every cause, but adequate fluid can help keep secretions thinner. Small sips can also replace harsh throat clearing. Warm liquids may feel soothing, but be careful with very hot drinks because they can irritate the throat or cause burns. Third, if nasal drainage is the main pattern, consider a saline spray or nasal rinse. Saline can add moisture and help remove pollen, dust, and excess mucus, but safety matters. If you perform a nasal rinse, use distilled, sterile, or previously boiled and cooled water. Never use ordinary tap water directly in a nasal rinsing device. Keep the device clean and follow its instructions carefully. Fourth, protect the throat from irritation. Avoid smoking and avoid secondhand smoke whenever possible. Strong cleaning sprays, perfumes, incense, and dusty rooms may also irritate sensitive airways. Keep a humidifier clean if you use one, and when the urge to clear your throat appears, sip, swallow, or gently exhale, instead of repeatedly forcing the vocal folds together. Fifth, test meal timing rather than banning half your kitchen. For 1 week, avoid large meals within about 3 hours of bedtime. Notice whether coffee, alcohol, chocolate, peppermint, fatty foods, tomato-based meals, or spicy foods reliably worsen your symptoms. Do not remove nutritious foods without a clear pattern. The goal is observation, not fear. Sixth, review your medicines with a pharmacist or doctor. Bring every prescription, every allergy tablet, every sleep aid, every inhaler, and every supplement. Ask which ones may cause dry mouth, worsen reflux, or make the sensation in your throat feel thicker. Again, do not stop medication independently. Finally, arrange an examination if symptoms persist for weeks or interfere with eating, sleeping, speaking, or your quality of life. A clinician may need to examine your nose, your throat, your lungs, your swallowing, or your medication list. Instead of simply prescribing another cough syrup, remember, the goal is not to eliminate every drop of mucus. Your body needs mucus. It protects and moistens your tissues. The goal is to remove the irritation that makes normal secretions feel impossible to ignore. And before we finish, let us review the warning signs one more time. If your throat suddenly feels blocked, you cannot swallow your saliva, you are struggling to breathe, or you cough up a significant amount of blood, seek urgent medical help. For symptoms that are persistent rather than sudden, do not rely on guesswork. A doctor may need to look at your throat, review your medicines, check for nasal inflammation, listen to your lungs, or assess your swallowing. The right treatment depends on the cause. And remember the real message of this video. After 60, constant throat mucus is often not one disease, and it is not simply old age. It may be a mixture of slower mucus clearance, dryness, postnasal drainage, reflux, medication effects, and repeated throat clearing that keeps irritated tissue sensitive. That means improvement is often possible. Track the timing. Keep fluids appropriate for your medical condition. Use safe saline when nasal dryness or drainage is present. Avoid late, heavy meals if symptoms rise after eating. Replace harsh throat clearing with a sip and a swallow. And most importantly, act on warning signs instead of waiting for them to become severe. Your throat is not betraying you. It is giving you information. If this video helped you understand what may be happening, subscribe for more clear, practical health guidance for adults over 60. And share this video with someone who is always clearing their throat but has never understood why. The cause may be quieter than expected, but now you know where to start.